In recent years, obesity has evolved into a global epidemic. In 2015, the Henry J. Kaiser Family Foundation analyzed statistics from a survey conducted by the CDC on overweight and obesity rates for adults by gender. They reported that 70.6% of American males were overweight as compared to 58.4% of adult females. More and more research has been conducted to shed some light on its connection to other diseases, among them chronic obstructive pulmonary disease, or COPD. Although obesity is not a risk factor for chronic respiratory diseases like COPD, there is clinical evidence that suggests an increasing influential relationship between the two. To date, COPD is the third leading cause of death in the United States, trailing behind heart disease and cancer. Ed Neuzil, board-certified nurse practitioner at the Allergy, Sinus, and Asthma Family Health Center, explains how our weight, and particularly excess belly fat, affects COPD.
COPD is one of those conditions that you can see in both men and women, but it has a tendency more towards the males. Well, COPD is actually a chronic obstructive pulmonary disease. So this is something that goes over a period of time, and it can include things like asthma, chronic bronchitis, emphysema. So it's kind of a cover term in the fact that a person's airway does not actually return to a normal state after we give them a bronchodilator. We know that the more weight we carry around, the more difficult it is for us to breathe appropriately. Lifestyle is a big factor, and we all want a good quality of life. We have a tendency to get together, and food becomes a big part of it. And I have had many patients gain significant amount of weight, and the more weight they gained, then the more short of breath, and they started to limit the things they do. So as we become more social and we're eating more, we should be exercising more. And I tell a lot of my patients that if you want to get off some of your medications, then let's get some exercise. The more exercise you do, the more healthier we become, the less we need medications to compensate for some of the things we see. So weight is a big problem. When we look at different problems like asthma, COPD, emphysema, a lot of what we do here is called spirometry testing. We actually measure your airway functions. And if appropriate, we'll actually give you a treatment of a short-acting bronchodilator and measure again. And by the difference in your airway functions, we can determine an appropriate medical protocol for you. Now, we also do something called complete pulmonary function studies. I have 2 individuals here that are certified on this machine, and it looks at things like lung volumes. When we look at things like asthma, COPD, that's an obstructive process. When we look at lung volumes, we look at more of a restrictive process. That's the fact that you just can't get a breath. It's kind of like being bear hugged or squeezed by a snake. It constricts you and restricts your ability to breathe. Another advantage of the complete pulmonary function study is we look at the oxygen and how fast does the oxygen get from your lungs into the bloodstream, because that really makes a difference. We look at resistance. If you've got increased resistance, when you start to do something, you try to breathe more, well, you're going to get tired a lot faster. And then looking back at diffusion capacity, if your diffusion capacity is reduced, guess what? It takes you a whole lot longer to feel better too. So these are different things that we can look at to help determine what is wrong if you're not breathing appropriately. Nobody wants to have COPD, but the more they can understand about this disease, even before they have it, the more we can prevent the disease.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the COPD and Your Weight tab on our homepage, yourhometownhealth.com.